Here.
That's correct. Okay. All right. All right. Would you please present SB 1282?
Good afternoon, Madam Chairman and committee members. My name is Louis Vizmar. I'm on the Pro Tem Policy staff, and thank you for the privilege of presenting this bill on behalf of the Pro Tem who's in Washington, D.C. Autism is now the fastest growing serious developmental disorder and affects 1 in 110 American children. Research indicates that early and intensive intervention, frequently referred to as applied behavior analysis or ABA therapy, may result in significant improvements in positive long-term outcomes for many individuals with this disorder. SB 1282 addresses an important problem facing consumers and families who are seeking effective ABA therapy. During the past 2 decades, concurrent with the increase in the autism epidemic, there has been a notable proliferation in the number of individuals and organizations that are providing ABA services. At the present time, there are no standards or criteria that reflect on the expertise or background of these practitioners. The ABA profession lacks any form of recognition or standing within the California Business and Professions Codes. Therefore, consumers may face significant difficulties and challenges in making an informed decision with regards to ABA programs and providers. This bill establishes a voluntary process by which the state will provide Title Act protection based on the education, training, and experience of the professionals that are providing these services. SB 1282 is an initial step in establishing standards and guidelines for ABA services that will assist consumers in making more informed decisions. Testifying today in support of the measures are Mr. Jim Gross and Ms. Kristen Jacobson.
Okay. Witnesses, step forward.
Madam Chair, members, Jim Gross on behalf of the California Association of Applied Behavior Analysis. We are very much in support of legislation that will, in fact, create an understandable, discernible standard for consumers to use in understanding how to choose one of these professionals. I think that while there are lots of different professionals out there doing this, the public does have a difficult time figuring out who has what training, et cetera. And the bill is intended to address that. My client is made up of individuals who have been certified by a national organization that is an accredited organization, which will also be here testifying today. And our principal concern with the bill at this point, we are in a support if amended, is that we think that more work needs to be done on the issue of how this nonprofit is structured, as set forth in the bill and in the analysis. Which types of professionals will be grandfathered in? Currently, the bill addresses both those with bachelor's degrees and master's. And there are some other very specific issues that Mr. Vizmara and the Pro Tem are aware of that still need to be addressed. But we are at a point where we want to continue to work on this bill because it's an incredibly important issue. And I want to point out, it's not just important for the treatment of autism. Applied behavior analysis is used extensively for various other types of conditions. And our goal is to make sure that all of those who need ABA services are able to have a discernible standard, not just those who have children with autism. So those are the issues that we're going to continue to work on. My client is here to answer specific questions if there are regarding applied behavior analysis, and we appreciate the opportunity to speak to the issues. Thank you.
Thank you. You're just here? Okay, go ahead.
Hi, Madam Chairwoman and other members. My name is Kristen Jacobson, and I'm representing the Alliance of California Autism Organizations, a consumer and parent organization. We have been working with the author closely on this bill. We think it's a very important piece of legislation to establish consumer protections. The applied behavior analysts work individually with children with severe developmental disabilities and often work on one-on-one situations. And so we think it's very important to have an established set of standards, and over time to continue to increase the standards. And by recognizing the profession and giving it more oversight, we believe that over time we will be able to do that. We also have, we've taken a support if amended position as well, and we know that there are several issues along the lines of really strengthening the consumer protections that we are still working on. But we would like to continue to have the opportunity to work on it with the author, with the Business and Professions Committee, and feel like our issues have been understood and that we are working on getting them addressed, and so we would like to support this very, very important piece of legislation.
Okay, so you and Mr. Gross are in support, kind of? If amended, if it continue working?
Yes, ma'am, that's correct. We see a pathway to be able to support the bill. I'm not sure that Ms. Jacobson and myself are on the same position on each of those items, but we're all both looking for that point where we can agree.
Okay, all right. Is there anybody else in support? Okay.
Thank you, Senator. My name is Jim Lantry. I represent the Interdisciplinary Council for Developmental and Learning Disorders, ICDL, as well as a group of military wives with children with autism and some autism treatment providers. The people I represent do something called DIR floor time, which is a developmental treatment. It is different than ABA. However, just as ABA needs to be credentialed, so too does DIR floor time, so that consumers can recognize that the person that is treating their child is someone who is qualified. And we are working with the author to include other forms of intensive behavioral intervention models in the program, in the credentialing program, and we support the bill fully.
Okay, thank you.
Madam Chair and members, Rick Rollins. I'm here today on behalf of three of the larger providers of ABA services here in California. Among the three groups, they serve thousands of children with autism in this state and employ hundreds of ABA providers. And we, along with our group that we are closely working with, the Alliance of California Autism Organization, stand shoulder to shoulder with the parent group to continue to work with Dr. Vismara and Senator Steinberg on working on this legislation. I'd like to add also it's been a privilege working with your staff on this legislation, and look forward and hopefully be able to follow it through the rest of the legislative process.
Okay.
Thank you.
Is there anybody else that's in support? Opposition? Okay, everybody is in support. Dr. Vismar, everybody's in support, but they're still working on the support. Is that my understanding?
Support if amended, yes. Okay. Everybody recognized, including the author, that there continues to be work. So far, discussions have been positive, and we'd like to continue them.
Okay, all right. Opposition?
Well, we're not opposed. We have concerns. Madam Chairperson, members, my name is Leslie Medina. I represent the Behavior Analyst Certification Board. They are a nonprofit.
Can I interrupt for just a second? Because I'm really confused about support unless amended or not opposed or have concerns. If you voted on the bill the way the bill is right now, would it be a yes or a no?
It would be a no.
That's
okay.
That's much easier to understand.
Okay. Yeah, before the opposition comes up, you had a question?
Well, just let if I'm through the chair, go ahead and let the opposition speak.
Okay.
All right. Ask my question.
Okay.
Like I was saying, the BACB is a nonprofit organization. They were established in 1998 to meet professional credentialing needs identified by behavior analysts, consumers, and governments of behavior analysis services. They are accredited by the National Council for Certifying Agencies, and they are endorsed by the Association of Professional Behavioral Analysts, Association of Behavior Analysis International, and the European Association of Behavior Analysis. We have been working with Dr. Vismara and your committee staff. This bill was amended considerably towards the end of last week. We have pledged to continue working with the pro tem and his staff and the committee staff and trying to work out our concerns. I'd like to introduce Jerry Shook, who's the CEO of BACB, just to identify a couple of those concerns. But we do appreciate all the work your staff has done, and we will continue to work in good faith to resolve our issues.
Thank you.
Yes, thank you very much. I'm Jerry Shook. I'm the CEO of the Behavior Analyst Certification Board. We started the board taking over the responsibility of the Florida certification program. The state of Florida started a program. A number of other states saw the need to credential behavior analysts, and so the state asked us to form a not-for-profit and provide those kinds of services with their examination, which we're in the process of doing. One of the things that happened when Florida transferred its program to us was that they had a number of individuals who either didn't meet the criteria to transfer in or chose not to. So we've been operating a program for the state of Florida for those individuals. We provide all the services for renewal, recertification, all the things that typically a board will do for these individuals. And our proposal is, and we're working with Dr. Vismara and others here on that, and I think hopefully we'll be able to reach agreement on this and a number of other things, to do a similar sort of thing in California and set up a separate not-for-profit corporation that would essentially take care of the nuts and bolts of determining a credential and maintaining a credential. All the criteria for doing that would come from sources other than us. Once those criteria were established, then we would implement it and do much as we have been doing with Florida. So that was one of our suggestions. A number of these issues may be oversight issues on the part of the committee. There have been some changes over the last few weeks on this bill. One I'd just like to sort of underscore is that we think that it's important that we also recognize individuals who hold licenses in California who have behavior analysis as part of their scope of practice. For example, psychologists, other professional groups like that. We think it's important that we recognize those individuals as well. Let me also mention that the criteria for grandfathering, although we support the notion of grandfathering, I think we need to work on the criteria to make them more objective and perhaps more stringent. The other thing that I would mention is that we run into a slight trademark problem, my lawyer tells me, using certified behavior analyst. I think that's, again, another one of those oversights that we probably can look over and to our satisfaction and those of the folks who are involved.
Thank you. Others?
Yes, Amanda Levy with the California Psychological Association. We have an oppose unless amended position on the bill. We've also been working with the author's office to address our concerns. And at this point, our concerns are, one, just to keep full inclusion of licensed professionals, including psychologists who are already doing this work. Some of our members are practicing under their psychology license. Some are also certified. So we would just want to keep that in there. And then we talked to the author's office about limiting the type of clients that somebody who is an analyst would see. So we don't want this to be blanket providing services for any type of individual. And those talks have been going well so far, and we continue to look forward to working with the author.
Right, thank you.
Madam Chair and members, pardon me, Charles Bakke with the California Association of Health Plans. We are listed in the analysis as being opposed to the bill. Our concern was not with the certification portions of the bill, which have clearly are a robust discussion that are ongoing as this bill moves forward. We do believe that parents deserve to have a rigorous review of folks' qualifications in dealing with their children with autism. Our concern was with provisions of the bill that appeared to be designed to compel health plans to cover ABA services, which is something that there's a long-running debate here in California nationally regarding. I think the amendments that were taken late last week pretty much take care of our concerns. There's one sentence that I still need to run by our folks. So at this point, we are reviewing the amendments, but we were opposed to the bill prior to those amendments. Thank you very much.
Thank you, Mr. Bakke. Senator Correa.
Thank you, Madam Chair. Just Mr. Vismara, I agree with you on the two goals that I think your bill is looking at: consumer protection, of course, and of course the other one is with the licensing, so to speak. What you're doing is you're giving consumers the information and knowledge of a minimal competency. Autism is essentially a tsunami, a tidal wave coming at us right now. Something like 1 out of every 50 male children now born has some autism spectrum. It's unbelievable. So by doing this, are we in any way creating a barrier to entry in terms of those individuals that they can treat autistic children. I just believe that the need and the demand for these folks providing this service is going to be so huge coming at us.
Absolutely.
That if we start saying you can, you cannot, then are we really limiting the resources available to a parent?
I certainly hope that will not be an unintended consequence, and I would look forward to working with all of the experts, consumers, and advocates to be sure that that does not happen. The bill is intended to have programs that are effective, well supervised, and work. The certification, the duties and responsibilities and privileges of those holding a certificate are primarily intended to design the program, to implement the program, and to supervise the outcomes so that they are effective. We actually hope that will be a stimulus for professional development. We also hope that by having those standards, more individuals and more providers who are qualified will become available.
Okay.
The actual folks working one-to-one across the table from the children, as long as they are being supervised by experts and expertise, will not necessarily hold certificates.
But they'll have to be supervised by experts
Exactly.
with expertise that are certified.
Yes. Yes.
Will that create a barrier to the services available?
No.
Dr. Yee?
Thank you very much, Madam Chair. Here's the concern that I have. You're clearly creating a new category of individuals, giving them at least a title of some sort, and eventually, and I think one of your proponents was talking about, eventually upgrading standards and so on. So I think the concern is that I'm not really clear about what exactly are these behaviorists able to do and not able to do. As a psychologist, I'm a behaviorist, so do I need to get a certificate in order to do that? LCSWs, are also behaviorists. They can be doing that. MFCCs are also, some are not behaviorists. Can they do that? And then I think the other thing that I'm kind of also hearing is that, I think there are other individuals who say, we also want to be certified. So are we piecemealing the treatment of autistic kids to the point where, on a behavioral stuff, we'll have one individual, and maybe those individuals are in play therapy. We're going to maybe license those individuals to do that. And I think as Mr. Gross talked about, DD individuals also get behavioral stuff. So autistic kids, then are we going to get EMR kids? What about them? Are we going to have another? So it's, you just wonder how much more we're going to be sort of giving titles to individuals, and then from there, dealing with practice, and then the whole notion of scope of practice comes in. So I think that's the concern that I have, and it's not clear yet as to where you stand on this and how far you're going to be moving or how not far. And if we vote on this, then are we going to get a chance to come back here to look at it? Or so if you can maybe help me understand that.
Thank you very much for actually very clearly identifying the challenges that are ongoing with this bill. There seems to be a consensus that having this bill and affording a voluntary certification that will allow consumers to make better choices is a good thing. Because of the various individuals who are doing this, because of the challenges and the complexity of the problem, identifying a bill that addresses all the issues, quite frankly, sir, has not been resolved and remains a work in progress. The author, Senator Steinberg, is committed to addressing not only what Senator Correa said of this not being a barrier of unintended consequences, but also to ensure that those individuals who are qualified, and I would look to experts such as from your profession and others, to determine what those qualifications are. That if you're qualified to provide behavior intervention for autism and other services, that you will then have this voluntary certificate. It's a Title Protection Act. It's not a scope of practice. It doesn't restrict anybody from practicing. It just merely says that if you meet professional standards, then you can identify yourself as being a holder of this certificate. We feel that that information will help consumers and parents. As a parent of a child with autism, I can attest to the fact that when you're dealing with the emotional trauma of dealing with the behaviors of that disability, any and all information that simplifies and provides access to a good program is really life-saving, and that's the intent of this bill. And we're committed to working with any and all stakeholders and experts who can help us get there.
Is it the Pro Tem's desire, or is his commitment that he will bring the bill back, because it looks like it's ongoing?
Yeah, well, yes. I mean, and the idea is that it needs a lot more work. We would be glad to bring it back, and we don't want unintended consequences. We don't want a bad bill, and if we cannot provide the information that will help consumers, the Pro Tem will not move the bill.
Okay. Mr. White and then Dr. Honesty.
Unfortunately, this strikes me as an example of what happens too much, and Senator Steinberg is very well-intentioned and has done big bills like this in education, but they need more work, and that's what everyone's saying. I have no doubt that this bill is going to get out of this committee, but what I think really ought to happen is that it should not get out of the committee. I'd be happy to vote for waivers later for it, but it needs, this is exactly the kind of legislation, frankly, that fits in with my constitutional amendment to spend a year where we don't do bills, but we do oversight and hearings. There are all these interested parties. We have this tidal wave that Senator Correa talked about of autism, and we don't know, and there's also, by the way, licensed professional counselors, some of whom are behaviorists. And that was an example of legislation that took a long time to do and was easier than this. And I think every one of us here is concerned about the rise of autism. And every single one of us feels for these parents and wants there to be help that they can identify. But my guess is, and probably Senator Yee is the expert on this, my guess is there isn't a consensus of how best to treat this, or even a consensus of what kind of training is best. Nevertheless, I think it's good to help parents. I just don't think we're there yet, as well-intentioned as this is.
May I respond, sir? I completely agree with you. What I would say, though, is that by having this bill, it brings the stakeholders to the table. It gets input. It gets diverse groups that perhaps have not had the opportunity to discuss, deliberate, and to do so in a positive manner. And I believe I can speak for Senator Steinberg that if we're not able to get that consensus, if we're not able to bring folks together, if we don't clearly identify, I think we've clearly identified what the goals are, and I think I can speak for Senator Steinberg that if we don't get there, if we're not able to hit the target, he won't move the bill. And I would love to work with any of your stakeholders, staff, or any folks that you could assist us with in achieving those goals, sir.
I appreciate that point. It's just that this is the sort of thing that just seems to me it takes longer, and our process doesn't lend itself. I appreciate your point that we need to do something, and I think it's a good idea. It's just sort of hard to do in the time frame. But I appreciate your point about getting everyone together.
We'd love to work with you, sir.
Dr. Onstead. You have another?
Yeah, I can't vote yes on the bill today I think it's many months away from a cooked bill. I see the need. But for example, if you just go to one section, the board of directors, 2 people from every entity that qualifies. According to this, every entity that qualifies, you would have a board that could have as many as 100 people on it, or 200 people. The San Diego Medical Society would qualify. They have 1,000 members with a code of ethics, with a lot of people who take care of patients like this. California Medical Association, the family practitioners. I don't know if your sponsors really want those people sitting on this board of directors.
I couldn't agree with you more, sir.
So
you're absolutely right.
It's so nebulous. Because if you're going to have a board of directors where you have 100 people sitting on the board of directors, woe to try to do anything as far as discipline or certification and getting together on that. So I think there's a lot more work that needs to go into this.
Well taken and completely agree, Doctor. Again, what was extremely, though, productive and positive about this process was getting the expertise and the assistance of the BNP staff, or at least looking at a potential structure by which we could move forward. There's a lot of stuff that absolutely needs to be done from a policy perspective. There's a tremendous amount of stuff that needs to be done from an implementation. But I would just offer that having this bill go through the B&B process committee and having the expertise of your staff has been incredibly helpful. And I think that I was encouraged by that the concerns of all of the witnesses who testified was also tempered by what I thought was a hopeful sign of optimism. And again, I speak for the pro tem that if we don't have a good bill that is fully cooked and meets the target, he will not move it.
Just a follow up to something you said, that this is really a bill that deals with title and not scope of practice. But I can kind of tell you or suggest to you how, because of the title, the whole issue of scope of practice seeps in. In a title, you have different qualifications in order to become, to be eligible for that particular title. Autism has a social-emotional element to it. And so if you're working with a autistic kid, you have to deal with some of the social-emotional needs. So that's part of, eventually that would be one of your criteria to qualify for that behavioral designation. All of a sudden, you have a title, and within that title says that you're an expert in dealing with social emotional needs of autistic kids. From there is an easy jump to then be able to treat social emotional individuals, and very easy then to jump from there to therapy. And that's where I think it gets really, really tricky when you are not clear or bringing all the stakeholders to kind of figure out exactly how do you sort of contain that scope of practice, or at least you have the appropriate training for the scope that you're looking for. And that's the problem that I have and the concern that I have. I think the last point that I want to make is something maybe you can answer. How do I vote for a bill that clearly is not fully cooked? And then if it's down the road, you may think it's fully cooked by then, but I don't. And then what I do then? That's the difficulty that I have in terms of putting my name next to a yes column for this particular bill, when clearly there are still so many issues that are out there.
Well, I would. I don't have the experience or expertise or the background to answer your last questions, Senator Yee, but I would give you the pro tem's personal commitment that one way is the bill could come back to the Senate, and opposition could then be noted at that time. My understanding was that, with all due respect, that having the bill heard in this committee was primarily related from a business and professions perspective, We've worked very diligently and with your staff. We tried to address the business and profession aspects with it, and I would be, grateful for your guidance and expertise in terms of how any oversight that you could provide and any guidance that you could direct me in terms of to be sure that the expertise and the concerns that you have are fully addressed going down the road. Because right now what's really happening... Sorry.
Okay.
Sorry.
Did you have another question? Then
I don't have a question. I had a comment, but very similar to Mr. Yee's. That Madam Chair, my comment's very similar to Mr. Yee's, which are I also have concerns that this bill is not fully cooked. And so I'm having a little difficulty here. But at the same time, on the other side of this, I know this is a huge issue that's on top of us right now. And so do we let this one out and then, as Mr. Yee says, later on can't pull it back? I'm struggling with this one.
Okay. Senator Oropesa.
I'd like to make a motion that we approve this item with the understanding, the clear understanding on the part of the author that the chair may ask this item come back to committee if there are, substantive and significant changes.
And I think he's made the commitment from the pro tem that we will pull the thing back. Yes.
Just before we vote on that, to explain why I can't support the motion, I just think this bill, even given the need, it's just too far to go. And what happens lots of times is, all of us know 1,000 times we've heard, well, this is a work in progress, this is a work in progress. And they do progress. And sometimes it becomes legislation. And I think this is just, we just need a lot more time. Like I said, I would support a waiver later on down the road if there were that much time to work with all the folks, but I think it's just too early now.
Okay. The bill having been seconded by Senator Oropesa, we'll make the vote, but with a commitment from the pro tem that the bill will come back should there be need for this committee to hear it ongoing because of the various factions that have talked to us here. Okay. Call for the vote.
Grady McLeod?
Aye.
Grady McLeod, aye. Wyland?
No.
Wyland, no. Onestad?
No.
Onestad, no. Calderon? Correa? Flores? Or Flores, aye. Oropesa? Oropesa, aye. Walters?
No.
Walters, no. Yee?
Aye.
Yee, aye. That's 4-3.
Okay, 4-3.
We need one more.
Yeah. We'll hold that.